Good evening. Today we have a case presentation about fibroid uterus.
A 40-year-old female who is para-3 live 3 was sterilized, hailing from Chennai from a low socioeconomic status, came to the OPD with chief complaints of abdominal pain during her periods for the past 2 months and complaints of heavy menstrual bleeding for the past 2 months.
So, abdominal pain during periods is also called as
dysmenorrhea. So, history of present illness. A patient complained of abdominal pain before and during her periods, which is in the lower abdomen pain, vague, sudden in onset, relieved on rest, and it's not radiating and is increased on walking. And she had a complaint of spotting PV occasionally for the past 20 days. There's a history of loss of appetite for the past 20 days. There's no history of nausea, vomiting, mass descending per vaginum, cough, cold, sore throat, or any weight loss. Menstrual history. Patient had a previous regular menstrual cycle, which is 3 by 28 day cycle, changing 2 pads per day. There is no history of passage of clots or any dysmenorrhea. Marital history, she is married for 20 years and it's a non-consanguineous marriage. Obstetric history, P3L3, previous 3 normal deliveries with sterilization, while the first child is a girl child of 18 years old, full-term normal vaginal delivery, alive and healthy. Second is a boy baby of 16 years who is a full-term normal vaginal delivery, alive and healthy. Third is a girl child who is 14 years old, full-term normal vaginal delivery, alive and healthy. Past history, there is no history of diabetes mellitus, hypertension, bronchial asthma, thyroid disorders, epilepsy, blood transfusion, any other previous surgeries or drug allergies.
How does thyroid disorders affect the menstrual cycle?
When the patient is a hypothyroid, there is a increased bleeding during the cycles, which is menorrhagia, and when it's in hypothyroid, it will be the opposite, ma'am.
Yeah, so hypothyroid can also have polymenorrhea and menorrhagia, and hyperthyroid can have hypomenorrhea and oligomenorrhea.
Family history, there is no history of any cancers running in family or any comorbidities. Personal history, there is no history of any reduced sleep or appetite, normal bowel and bladder habit. Patient consumes mixed diet. On examination, patient is thin-built, moderately nourished, conscious and oriented. Her height is 155 centimeters, weight is 50 kgs with a BMI of about 20.8. On examination, there is a pallor present. There is no icterus, cyanosis, clubbing, lymphadenopathy. She was afebrile. Blood pressure was 130/80 millimeters of mercury. Pulse rate was 86 beats per minute. Thyroid examination was normal. Spine, there was no scoliosis and it was normal. Bilateral breasts were normal. Systemic examination, cardiovascular system, S1, S2 heard. There was no added sounds. Respiratory system, normal vesicular breath sounds heard. Per abdomen inspection, there was no visible lumps or ascites or any engorged vein seals. Palpation, there was a 20 weeks firm mass which is felt in the midline, regular, non-tender, mobile from side to side. The lower border was not reached. Transabdominal tubectomy scar was present. In percussion, there was a dull note over the mass, no evidence of free fluid. In auscultation, bowel sounds were heard and it was normal. Local examination, in genital area, pubic hair was normal, labia minora was normal and it was replaced by leukoplakia. Per speculum was done, vagina and cervix was healthy, there was no descent or any discharge. Per vaginal examination, it was a midline mass moving with the movement of the cervix, which is corresponding to 18 weeks of gestation. Anterior and posterior vaginal wall were smooth, groove sign was absent.
Yeah, so if groove sign is present, what does it suggest?
Any adnexal mass.
Yeah, or ovarian mass.
Pap smear was done for this patient and it was a normal pap smear. We did an ultrasound abdomen and pelvis. The uterus was bulky with an endometrial thickness of 6.5 millimeters. Multiple fibroids were seen and there was a right hydroureteronephrosis for the patient.
So right-sided hydronephrosis is more common than left side. Why? Because the
bowel.
Yeah, because of the sigmoid colon lies between the pelvis and the left side ureter, whereas the right side hydroureter gets compressed easily with any pelvic mass. So right side is more common than the left side. So what are the other names of fibroid and where does the fibroid arise from?
It's either leiomyoma or myoma are the other names. It arises from the germinal stem cell nest in the myometrium.